Namaskar, friends. Let's look at these 30 wellness secrets, three-step approach to your life without medicine. All that we require to do is gain the right knowledge and be disciplined. Knowledge you can only do by way of learning, unlearning, and relearning. See, friends, we are having 10 repeat daily wrong habits and abuses. We are literally abusing our body day in and day out. What are those abuses? You may be saying that, oh, out of 10, I want to do one. One abuse is sufficient to put you to difficulty. What are they? Chronic stress, lack of 7 hours night sleep between 10 p.m. to 5 a.m., no physical exercise, intoxicants like alcohol, tobacco, stimulants like coffee, tea, etc., dehydration, wrong way of drinking water, not taking sufficient water, constipation, gas, bloating, and poor gut health, unable to clear the bowels, multiple times eating in a day. We are all habituated to eat breakfast, lunch, and dinner, and then coffee, tea, snacks in between. So every day, most of the people are eating 5 to 6 times. Eating 5 to 6 times over a period of time will increase your insulin resistance. Processed, packaged food, sugar, fast foods, bakery, refined oils, milk, cool drinks, ice creams, etc. They cause lot of high insulin levels in the body. Lack of nutritious food. We don't eat nutritious food at all. So there are no vitamins and minerals to our body. There are a lot of deficiencies. Remember, friends, other than water, anything else you put in your mouth is food which spike sugar and insulin. Over a period of time, you develop insulin resistance and food gut health. We all know 10 overeating habits, wrong habits. We discussed that. All these 10 or any one of that can cause over a period of time belly fat and overweight. They're clear disorders. Many people they don't mind. They have to check those 7 blood tests which we talk about it. Fasting sugar, fasting insulin, HbA1c, thyroid profile, lipid profile, B vitamin and D vitamin. When you do the your health check on 10 parameters, 7 blood tests, you will know where you are. So what happens, friend? The above 10 are few of the habits cause toxins in the body, nutritional deficiency, insulin resistance, inflammation in the body, which causes hormonal imbalance. When you have a hormonal imbalance, that is the root cause for lifestyle disorders like belly fat, overweight, hypertension, dyslipidemia, PCOS, CVD, thyroid, pre-diabetes, and diabetes. Understand, friend, diabetes is the last one to come for a lot of people. Now let's look at the 7 stages of disorder. See, friends, when there are floods, first your ground floor will get inundated with water, then first floor, second floor, third. Similarly, let's look at how this disorder progress. The ideal situation is people have fasting blood glucose below 90, could be 80 to 90. HbA1c is between 4.8 to 5.2%. Fasting insulin, this particular test is not done in a lot of labs and not recommended by the doctors. It is also not available in a lot of packages. So this test is very important. But this level should be below 6, whereas lab says between 3 to 25 is okay. But ideally is below 6, right? When this condition, their insulin resistance will be below 1.5. Below 1.5 means insulin sensitive. Above 1.5 is insulin resistance. You will see over a period of these wrong habits, what it causes is the insulin resistance mild. That means what, friends? Fasting glucose could be between say 80 to 99. HbA1c could be 4.8 to 5.6%, below 5. But fasting insulin could be beyond 7. So 7, it could be 10, 10, 15, 12, 15, 20, 30, like that. So what happens when the insulin resistance is calculated? Fasting glucose multiplied by fasting insulin divided by 405. The value, if it is above 1.5, that means your insulin resistance mild. What is insulin? What happens whenever anybody has a insulin resistance, they are not able to hold their hunger. They'll feel frequently hungry. They have a fatty liver, belly fat, obesity, cardiovascular problem, PCOS, thyroid, BP, etc. Stage 2, that means that is increasing. We continue doing the wrong habits. So what happens? Fasting glucose is still under control, friend, below 99. HbA1c is still below 5.6%. But fasting insulin could be beyond 7, 10, 15, 20, 25, anything. So when you do the calculation of fasting glucose, multiplied by fasting insulin divided by 405, the value is beyond 3. That means you have moderate insulin resistance. What is stage 3? Severe insulin resistance. In this condition also, friend, lot of people have fasting glucose below 99. It could be many times 80, 85 also. HbA1c also could be below 5.6%, maybe 5% also. When we only do fasting glucose and HbA1c, we feel that we are great, but the person is already overweight. Lot of times we see friends, people which are overweight and belly fat, when they get the blood test done, they say everything is under control, everything is as per the limits, but the person is abnormal. So that's the why people are not taking insulin. So that's how they will not know the problem. Friends, it is impossible. If all parameters are all right, how come you're abnormal with the overweight of 20, 30 kgs? So we need to check PP insulin, I mean fasting insulin. What happens in especially severe insulin resistance cases, friends, their sugar, fasting sugar could be around 90. PP sugar will be around 80, 85. See, generally other way around. Why? That means their pancreas is producing tons of insulin. They are highly insulin resistant. I've seen people, they may not have pre-diabetes, they may not have anything, but they have already got a stent because they already have high cholesterol and probably cardiovascular diseases. So what happens when until this stage 1 to 3, people can develop belly fat, fatty liver, high cholesterol, high blood pressure, stroke, dementia, heart disease. All this can happen, friend. What is stage 4? Stage 4 is pre-diabetes. That means what? Insulin resistance is above 5. Need not be. Many times I've seen people with above 1.5 also, they could be pre-diabetes. So fasting glucose could be below 125. Many times, sometimes it could be people have below 100 also. So such people will check only fasting glucose and they are under a wrong, false, understanding. So HbA1c is above between 5.7 to 6.4%. Fasting is definitely above 7. It could be 10, 15, 20, 30 also. I've seen people with fasting insulin beyond 30, 40 also, friends. What is stage 5? Stage 5 is insulin resistance and diabetes. Their insulin resistance could be beyond 5 or it could be beyond 3 also. We cannot say. Fasting glucose is definitely above 123. HbA1c is definitely between 6.5 about, sorry, 6.5 above. It could be 7, 8, 9, 10, 11, 12 also. Fasting insulin is definitely above 7. It could be, we don't know how much it is, 10, 15, 20, 30. What is stage 6, friend? If you continue to be diabetic and continue taking medication, continue following eating multiple times and doing all those wrong habits, you will go into severe diabetes over the years. This all will take a long time. When a person is diabetic, they all have, high thrust, increased thrust, slow healing, fatigue, and then blurred vision, frequent urination, unexplained weight loss. So, but friends, it is not necessary that you have to have symptoms. I've seen people with HbA1c 11%, no symptom. Don't wait for symptoms. If you are overweight, if you are above 17 years age, you check fasting sugar, fasting insulin, and HbA1c, friend. What is stage 6? Stage 6 means you have literally worked very hard to get that severe diabetes. What is severe diabetes, friend? The fasting glucose is beyond 200. Fasting insulin could be started coming down, maybe around 7 or below 7, friend. So that means the pancreas is already worn out over the years. Now the stage 7 is what? Their pancreas is producing very, very low insulin, like a type 1. That means they become insulin dependent. Generally, what is type 1, friends? Type 1 is for the people, it's autoimmune disease, generally happens in children. And now from type 2 diabetes, you with your no knowledge, wrong way of treatment of your methodology, you become type 1. So you are dependent on insulin. That means you become like a type 1 diabetes. Friends, my name is Gangeshwara. I'm not a doctor. At one time, my health was very poor. I was taking 11 medicine. I was diabetic, blood pressure, kidney stone, cholesterol, and all that. For 4 months, I've improved my health from 80%. And if anybody is interested, they can join my WhatsApp group. They can watch my YouTube videos. My mobile number is 9840852996. Friends, knowledge and discipline are the gateways to your health span. Please subscribe to my channel, go through the other videos, enhance your knowledge, be disciplined, friend. All that you have to do is you follow the Dinacharya of 10 daily steps of Dinacharya. I can guarantee you, if you are in initial stage of diabetes, you can get rid of your diabetes in a few months' time. Thank you very much for listening. I appreciate your time.